Well, hello, personal health and wellness. Welcome to substance abuse. Some of the items that we're going to cover in this video include a definition of what substance abuse and addiction are. We're going to identify those substances that are most commonly abused. Then we're going to create a framework of what the consequences of abuse looks like, and we're going to range that from minimal all the way to a severe consequence that could occur. We're going to talk very specifically about something called deaths of despair, and then we're going to dive into some of the aspects of why it's so important for you to be aware of substance abuse and how to prevent it. But then at the very end of this video, we're going to talk about some of the emerging issues that are occurring in substance abuse. Then in the second video that you're going to watch, it's going to talk very specifically about substances that are abused, including alcohol, tobacco, vaping, and marijuana. Some of the quotes that we want to begin with are the number one thing that I love about this video, but the compelling issue that I hope that you all will understand about substance abuse is we don't choose to be addicted. What we choose to do is deny our pain, and this is really critical in coping. And certainly that is ultimately what we see a lot of people falling into addiction trying to do, is they're trying to cope. And so that is one of the issues that we hope that you will understand as we dive into this content. But then also, I love what Mark Twain here says: quitting smoking is easy. I've done it 100 times, right? So the unique thing that I want you to know from the get-go is if you smoke and you've ever tried to quit, you get my ultimate respect. And if you smoke and you actually have quit, you get my biggest high five. What a journey and what a work you've done. It's just remarkable. It's a very difficult thing to do, and so we want to go ahead and give you that as we start this, that we understand that this is not something that's easy to approach. Another thing that we want to see here is the quote by F. Scott Fitzgerald, where he said, "First you take a drink, then the drink takes a drink, and then the drink takes you." And that is ultimately the journey of so many people that have subdued and been overcome by different substances. And so we want to walk into this understanding that this is a tough one. And so with that, we have to agree that this is going to be a challenge for all of us to look at. So what is substance abuse? Well, it is a set of related conditions that's associated with the consumption of any substance that causes mind and behavior altering issues to occur. So this is most commonly associated with something that has a negative behavior or health outcome. Now this is complex because we're looking at things like marijuana that have a very critical line in the sand that's drawn, and so you stand on one side or the other, right? And that is kind of common, but this is what socially will divide us, and we don't want that. We want to come together and find solutions. So the social attitude is, I agree that there's a benefit to using marijuana medically, or the social attitude is there's no benefit, and the other side of that says there is because it helps my anxiety, it helps my pain. And the other side of that line says, well, you don't understand the destruction that's caused in my life or my loved one's life. And so it's very complex. Another thing that's kind of standing in the way of us really getting anywhere here is there's a lot of differences in political but also legal responses to some of the substance abuses that have occurred. And so it's very complex, right? So as we go into this, we have to agree there's a lot of complexity in this issue. Now, some of the top known substances for abuse: alcohol, tobacco, prescription medications, which are finally getting some traction on understanding kind of how this has happened, but also the depth and the breadth of what has happened. And then we're also looking at marijuana. We're looking at illegal drugs like cocaine, methamphetamines, and heroin, some of the bigger ones out there. But then we also know that vape is a substance of abuse, and I know that that makes me very unpopular with a lot of people, but that is the truth, and hopefully we can give you some information as to why that is at the next video. So when we kind of look at substance abuse, we have to understand that abuse is in a range, and that ranges from totally unintentional, meaning like they didn't want it, they didn't choose it. Like this is that very sad situation where someone is given a drug and they didn't ask for it, they didn't even know it was in their drink, and then something very, very bad happens, like rape or murder. And so that is an unintentional substance abuse. What we know is that that ranges all the way over to addiction, where people are using this substance most, if not all, days of the week, and there is a negative consequence attached to it. It becomes compulsory, where that substance is now sitting on the throne of their life, and it controls the behaviors as well as the actions that this person is involved with. It's very central, and it's also very emotional to them, and they need it and they crave it, and that is something that is very difficult for a person who's not addicted to always understand. Now, there is kind of this outlier, and that's called binging, and this is that person who does really good Monday through Friday, and at Friday night sometime they say, it's Friday, I'm gonna get tore up, and they expose themselves to a large or heavy dose, maybe even a bolus of a substance. This is very common with alcohol, and the rest of the week they're pretty much off of it. But this is a substance abuse format, and we see negative effects coming from that as well. So we have to understand that this framework that we talked about of negative effects or negative outcomes or consequences will have kind of some range to it as well. So let's start with just what minimal consequences looks like. Well, some of the lighter things that occur from substance abuse, number one, you can get really smelly, and this can be like true straight up body odor, but it can also be the fact that you could be around people and they smell like alcohol, right? So you've kind of been around that person before, and you know, it may not be that foul, but body odor certainly can be foul, and that is one thing that comes about. Another thing is you can oversleep, and some of you are like, no, I don't oversleep, I love to sleep and that's my hobby. Well, that can be detrimental to your ability to hold down employment or be successful in school, or even be social, right? So we don't want to miss out on things that are important, that really do have value in our lives, but that oversleep can occur. Another thing is you can get bloated. And now bloating is kind of one of those things that comes and goes, but largely we feel like bloating is probably not the worst thing that could happen to you, and so we stick it in the minimal consequences. But there are some gastrointestinal things, and again, this is kind of like bloating. It's not the worst thing that can happen, but it can definitely mess with your social but also your work life, and what we're saying there is you might have to go to the bathroom, and you have to go to the bathroom a lot. Another thing is you could have some accidents, like you could end up driving your car into a dumpster, what we have here for you. But the worst is that you just drove your car into a dumpster. It's not like you're going to have long-term bad negative outcomes from that. You might have some cravings that are odd. You might be preoccupied, thinking about, well, I know this is the work week and I need to be here doing the work, but I'd really like to have a cigarette break or have a drink, or I'm thinking about that drink that I'm going to have later tonight. And then lastly, you could have some poor course performance, so it could definitely affect the ability to be successful as a college student. Another thing that we want to look at here is the next level of consequences, and so we're stepping it up a little bit. These are moderate, and the one thing that we know about moderate negative consequences is it usually involves a loss or a disruption in relationships. Another thing that we might see is a loss of employment. So you could lose your job because you overslept, and so that's kind of taken that to the next degree, right? We also know that some people have liver damage, which could be even an acute liver failure, and that's pretty bad. It's recoverable, but it many times doesn't recover because people tend to progress into the substance abuse rather than fall away from it. Osteoporosis, which we'll kind of cover more as we get into some other things in this class, but you know osteoporosis is bone mineral density, and once it goes, it's very hard to replace. Another thing is people stop eating, and I don't mean this necessarily from a anorexia eating disorder. They just don't eat, and this is something that we see a lot with smokers, but also with alcoholics. They just kind of choose that substance over food, and so they're losing nutrients that they need for proper health. Another thing that we see there is anemia. People lose the ability to produce iron or get iron in their blood, which helps to fund red blood cells and then ultimately activity that they need to do. Obesity is often a result of long-term alcohol use, and so we have been able to connect that. People fall, which, you know, I mean, I know if you fell before, you know it happens very quickly, but if you fell and you've been injured from that fall, you know that that's a very traumatic thing to have to deal with. And then guilt and shame. This is something that a lot of people suffer from, and they tend to cope with that by adding to the substance to deal with that guilt and shame. Another thing that we want you to look at here, though, is the severe issues that come along from using substances, and number one on that list is overdose. And this is a picture of a patient who's been in overdose, and this is kind of what you would see if you went to see a person who's in the hospital for overdose. They're typically on a ventilator, hooked up to a lot of machines, getting a lot of work done to them. It's a very sad thing to see, and it definitely will change your direction if you ever have to go into the hospital and see someone who's overdosed. Another issue there is definitely rape and sexual violence, and we're going to look more into that in Module 6, but definitely rape and sexual violence is a severe consequence that is often attributed to substance abuse. Unfortunately, we can't tell you a percentage of rapes and sexual violence that occur that had substance abuse tied to them, because that data is just so difficult to obtain. We do know that cancer ultimately is a result of long-term substance abuse, and we talk very specifically about that in the next video, especially with alcohol and tobacco. Another issue is liver failure, and that is mostly due to alcohol, but the liver does a big job in trying to mitigate the body's response to alcohol, and ultimately it does fail at doing so because it's overrun for so many years. And then you could be in jail or prison, and that's a very bad place to be. I don't know if any of you out there could give us some stories about what it's like to be incarcerated, but no one will ever say that it's a joyful experience, and so that can go on long term as well. And then ultimately this death of despair that we're going to talk about in moments, in just a few moments. So why is substance abuse important? Well, we know that HIV and AIDS is a big deal out there, and so they share needles or they get raped because of HIV being so easily transmitted. That could be a pathway for that. We also know that motor vehicle crashes and fatalities are a big issue out there, and so we want to avoid those certain situations. That is number 5 on the top 10 causes of death, and that is ultimately accidents. And so we see motor vehicle crashes and fatalities coming from substance abuse and being the top 5, or number 5 in the top 10 as far as causes of death. So we know that that's out there. We know that things like child abuse and violent behaviors at home and domestic violence are very commonly associated to substances, specifically alcohol and drugs, but they often accompany these 3 things happening. We also know that crime and homicide both have a large connection to substance abuse. I think about a little boy who was on my oldest son's baseball team growing up, and how his mother was murdered because she had some drugs and some other people wanted those drugs. And so I remember talking to her and seeing her at different baseball games, and it's really a sad situation to know that that is how her life ended. I think about people who undergo depression and they kind of feed into this constant loop of depression because they go back to using this coping mechanism of alcohol, drugs, and other substances. Suicide is almost always accompanied with a drug. In fact, what we know is that 20% of people who commit suicide have some type of illegal drug attached to that, and 22% of people who commit suicide have alcohol attached to it. And so suicide is definitely a variable out there that we want to get a hold on, because it is definitely driving upwards, and we'll talk about that here in just a moment as well. Again, cancer definitely comes in, and we want to know about how to prevent cancer because it's number 2. It's killing people at a very high rate. And then ultimately overdose comes in at the end, and we say we cannot let people go down from overdose because that kind of does trend to suicide, and there's a lot to say there, but many times what we know is that overdoses occur as in a suicide attempt, and so they are very successful though, and we want to prevent that from happening as much as we can. So what is a death of despair? Well, 1 in 12 adults currently fights a substance abuse disorder. And so what we know is that between 1999 and 2017, a period of not even 20 years, what we saw was an increase in overdoses of nearly 400%. So it went from 6.7 deaths out of 100,000 to 32.5. And that was a big jump. And what we know is that alcohol liver disease increased from 40.6 or increased by 40.6%, from 6.4 to 8.9. We know that suicide rates, they've increased upward to 38%. And so we see these folks out there, and we know that they're dying simply because of substance abuse related issues. And so we call these deaths of despair, and you can look this up and find kind of more information out there. There's a lot of groups who follow this, including the CDC, but we know that this is definitely an issue that we have to face. And of accidental deaths in the US, drug overdose, which is an accidental death, and remember that's 5 out of the top 10, is the leading cause of accidental deaths. And so that is a big issue, and we want to look at that and say, how can we mitigate this risk? Well, another thing that we have to talk about is some of the things that are also going on, like teenage pregnancy is very commonly associated to an alcoholic beverage, and then maybe kind of a lighter thought on what sexual activity looks like, and then ultimately that leads to a pregnancy. There's songs written about this, right? There's things out there that we know, well, they had too many beers, they got a little too close, they didn't think about it. So you know kind of what goes on there. Sexually transmitted disease is also another issue that is commonly associated with substance abuse, but again, we're taking kind of an emotional stance here and saying we've let our guard down, our inhibitions are down because we use this substance and now this has happened. Fetal alcohol syndrome, which is really bad because now instead of affecting just the person in who used the alcohol, now we're transitioning that down because a mother used alcohol throughout their pregnancy, and that causes an addiction to take place in the baby, but also some other negative health issues. These people often will have liver and heart problems earlier in life. They also have an increased risk of cancer. So we talked about that earlier. Let's just kind of identify what that looks like. People who use alcohol and tobacco, they have higher rates of esophageal, breast, colon, and stomach cancer. These people also have legal problems. They can't pay certain things that they need to pay, and so they get in trouble. And that what we know is 1 out of every 3 homeless people will say they have a substance abuse problem. That's the ones who are willing to admit it and confess it. But we know that there are a lot of homeless people out there who probably have not addressed that. And so some of the emerging issues that we need you to be aware of. Number one is there is a large adolescent abuse issue going on because they have access to it, and the safety issues are alarming. We also see this really going up in military and veterans who are returning from war because we don't have the greatest return methods, that they're really struggling, and so they choose to move to a coping method of abuse of substance rather than cognitive behavioral therapy or other therapies that might be beneficial. We know that services to mental illness and substance abuse through the federal government are limited. If you looked up where to go in LaFleur County a few years ago, you would have found nothing. We just now, in the delivery of this content, have a inpatient place to go in Poto, and I'm really excited about that because I think that's going to help a lot of people, especially men. We had places for women to go. We didn't really have a place for a male to go, and so now we do. But also this opioid crisis that is going on, and so I have a couple pictures here I want you to see, and the picture over on the left says that these are states that have a significantly higher opioid related death number, and you see Oklahoma is right there in the highest level, and so that, but then also coupled with this unique fact over here on the right, where you see Oklahoma has more painkiller prescriptions than they do the number of persons, and so that has got to get our attention and say Oklahoma really needs help. Well, you live in Oklahoma because you're going to school here, and maybe you live out of state and you're going to school here, but Oklahoma needs help. And so we have to get this message out there, and this is why this is such an emerging issue. Another one though, going back to these adolescents and these kids, what we know is that addiction can begin early. And so we see this all the way down in middle school, and the number one cause of death in middle school age students is suicide, and so we want to get this message out there, but this is a developing issue because those brains are developing, and what we know is that vaping and e-cigarettes are very popular with students, and that kind of is a gateway to other drugs. But kids are super susceptible to peer pressure, right? And so they will be out there, they will be posed to trying things because they can obtain access. I mean, I think about all of the things I was able to get to when I was a kid, including cigarettes and alcohol, and now it's just that much more because they have access to medically dispensed marijuana. And so those things have to be looked at and said, where is the line in the sand for them? How do we keep them from doing that? Well, when I was a kid, we were taught to just say no. And what we want to tell you is that that didn't work, because if it did work, then we wouldn't see the onslaught of addiction that we do today. So we want to tell you that instead of teaching just say no, we want to say let's teach better coping mechanisms, and that is kind of a difficult thing, but it's something that you're going to get to look at in your assignment, is to what you can identify with as a coping mechanism that keeps you away from substance abuses. So I hope that you've kind of caught a few really good points here. As we transition into the next video, I hope that you enjoy kind of the things that we look at for the specific substances and what they can cause. We'll see you then.